All right, let's dive into our UKMLA clinical walkthrough for the urinary frequency case. Welcome to this clinical walkthrough on the urinary frequency case for the UKMLA. It's brought to you by Mediate, your 24/7 practice partner. Now, this case is a really common one, and honestly, mastering the little details is what's going to make all the difference in your exam.
So here's how we're going to break this down. We'll start with the initial encounter, then move into structured history taking. After that, we'll screen for differentials, hunt for those critical red flags, and wrap it all up with diagnosis and management. A nice, clear 5-step plan.
Okay, let's jump right into part one, the initial encounter. You know, how you start things off really does set the stage for success. Those first few moments are so important. So here's what you should be picturing in your head. The patient's going to be a man, probably 60 or older. His main complaint is urinary frequency. Now, this is absolutely key. He's not going to volunteer that he has back pain. You have to go looking for that information. And hey, don't be surprised if you see a PR mannequin in the room, so just be ready for that exam component. Your opening line, keep it simple, professional, and exactly like this. Hello, I'm one of the doctors here today. Thanks for coming in. How can I help you today? It's perfect, it's polite, it's direct, and it just gets the ball rolling. All right, moving on to section 2, structured history taking. This is where we really get into the nitty-gritty and gather all that core information using a prostate symptom checklist. Okay, so you've got to be systematic here and ask about all the lower urinary tract symptoms. But, and this is a big but, you have to use language your patient will understand. So run through this friendly checklist. You'll ask things like, how often are you going during the day? Or are you waking up at night to pee, and if so, how many times? You'll cover urgency by asking, do you ever need to rush to the toilet? Then you'll get into the flow itself. Is your flow weaker? Do you have to strain or wait a while to get started? And what about any dribbling after you've finished? And finally, you'll wrap up by asking, does it feel like your bladder isn't completely empty? See, using a framework like this makes sure you don't miss a thing. Okay, on to section 3, screening for differentials. Once you've got a good handle on those prostate symptoms, your next job is to think about what else could be causing this. We need to rule out other common culprits. And the great thing is, you can screen for these pretty quickly. For a UTI, it's a simple, any burning or discomfort when you pass urine. For an STI, any recent new sexual partners. Then you'll check for things like a history of diabetes, ask about new medications, like water tablets. And finally, don't forget lifestyle stuff. Have you been drinking more coffee, tea, or fizzy drinks lately?
Right, section 4, and I really want you to listen closely here. This is about hunting for red flags. Honestly, this is the most critical part of your history. You absolutely have to be on the lookout for signs that something more serious is going on.
And here's the thing, I can't stress this enough. The patient will not volunteer these symptoms. You have to ask about them directly. Think of yourself as a detective here. It's your job to uncover this information. So your first critical question, word for word, is this. Any recent back pain, especially in your lower back? You're screening for potential bony metastases with this one. And your second critical question, any weight loss or fatigue recently? These are what we call constitutional symptoms, and they can be a big clue pointing towards an underlying malignancy. Remembering all this and putting it together when you're under pressure, that's the real test, isn't it? A great way to solidify all this is to practice. You can actually run through this exact case right now and get objective feedback on mymediate.com. Just a quick note on the examination. If you see that mannequin, yes, you are expected to do the PR exam. But here's the key takeaway. If you've already found red flags in the history, the exam findings don't actually change your initial management plan. The referral is already decided. Okay, we're at the final stretch. Section 5, diagnosis and management. Let's put everything together and build your action plan. So what's the trigger point? When do you need to seriously suspect prostate cancer? It's pretty clear-cut. It's when you have that persistent urinary frequency, plus at least one of those red flags we talked about. Whether it's weight loss, that lower back pain, or maybe you find a hard nodular prostate on exam. That combination is your signal. Your management plan from here is a clear 4-step process. First, you're going to order a PSA blood test. Second, you'll perform that PR exam if it hasn't been done. Third, if the patient told you about back pain, you'll order a back x-ray. And finally, number 4, you'll make that 2-week wait urgent referral to urology. Simple as that. Look, if you take only one thing away from this whole walkthrough, let it be this. For any man, 60 or older, who comes in with just urinary frequency, you always have to screen for prostate cancer. That means you are always asking about back pain and weight loss, no exceptions. The moment you find a red flag,
Your next move is that urgent referral. Got it?
So there you have it, the complete framework for handling this case. The best way to make this second nature? Go practice it. You can do this exact scenario right now on mymediate.com.